So welcome everyone to this panel, this EF Festival panel. In this session, we'll be talking about making health promoting technologies accessible to all. I have with me Morenike Akinyemi. She's a digital health enthusiast and she facilitates the use of technology to address clinical priorities. She develops strategies and tactics to solve complex health system challenges. Welcome, Morenike.
Thank you, Ebele.
And I also have Arnaud Nibaruta. He's a Burundian Rwandan educator and a healthcare innovator. He works to make higher education accessible, especially to refugees and displaced people. And he's also the co-founder and operations lead of .pharma, which is an e-pharmacy and virtual health platform. Welcome, Arnaud.
Thank you, Dr. Ebele.
So I'm really excited to have this conversation with both of you. We really want to talk about the question of access. So as we get into it, I'm going to start with Arnaud. Arnaud, if someone asked you, what must you absolutely do to design a digital health initiative that's impactful and people love using, what would you say?
That's really a good question. And I think that's even the point of business in healthcare, is now in digital health and healthcare technology. And I think if I had to say one thing in terms of, making an initiative or a technology that people love is like listen to them and make them participate and putting them at the center of that technology. Here, I mean, most of the time we do market research, we do iteration, we go to the field, but most of the time innovators have that tendency of, talking to the people instead of listening to them. And I think listening to the people, listening to the users, to know what they really want, what problems they have. That's really what makes technology or what makes a healthcare initiative to be loved and to be, even sustainable.
Perfect, thank you. And maybe we can build on that. I would love to know when you say listen to the people, what does it look like to listen to people versus talking to them?
Yeah, exactly. This plays in terms of participation. How do you make people participate? Like since starting from the state of the idea, when you have the idea, did you really talk to people who you plan to make them use that technology? Let me take an example. For example, taking a technology. I'm talking about a technology in general, that's not .pharma. I hope we have to dig deep in what we do. A platform that that helps people to measure their physical activities, like how many steps you made. But if you, for example, you made that in terms of I want to make a technology that count the steps of people, like the steps they made per day, you may just do a platform, a wearable, a device that just counts the steps. But when you go to talk to those people who have NCDs, who have who has obesity or who are overweight and want to, for example, reduce some weight, you may find that you may hear more about them, like what makes you want to be physical active, what makes you want to use that. And for example, from that, you may think about, beyond counting the steps, how for example, can I create a community of people who are going to use that technology so that they can share ideas? That's an example of a technology that just is talking to the users, and another one that listened to them and did beyond. They didn't just focus on what they wanted to do, but also listening to what they had to do. Another thing I would say is involving the people in terms of feedback and constant feedback, creating occasion to always receive feedback about your initiative. This means that you're really ready and flexible to any change that you would like to make from the user point of view. Because like I think they are the ones who own that technology, and that's the difference. You know, doing your things and like delivering to the users, and just doing things, but also listening to those to the users.
Got it. Thank you. That's very interesting that you said the users own the technology. I think oftentimes you think of the founder as owning the technology, but it's interesting when you frame it in that way.
It changed. It changed, really. It changed. Yeah.
Good to know. Thank you.
Yeah.
I think I got an image that will stay with me. Relatedly, Morenike, I wanted to hear from you about, okay, so he's talked about, I asked him what you must absolutely do. I wonder if there's anything else that you would say. And he talked about not talking to, listening instead of talking to people. I wonder if there's anything else you would say like you absolutely must not do in, so what must you not do in design, digital health promoting technologies?
What you must not do. There are a lot of things not to do. That's a bit trickier. Well, things not to do. I would say it would just be the flip side, right? Like not creating something with the end users. Like what he said, there has to be co-design for any technology to be impactful, like throughout all the phases. Like he said, through the idea, like validating that, getting them to be really involved, think about them as a whole human being, not just the one thing you're trying to solve, and understand how it impacts all the different facets of their lives. So if you do not want your technology to be successful, then create it in isolation. Don't talk to the people, don't truly understand the problem, because sometimes people get excited about like technology for technology's sake, like, oh, this is so cool, I'm going to create this. But then what impact is it making? Like, what clinical problem are you truly solving? Like, you have to be able to really drill it down if you want to make something impactful. And obviously there's the huge piece of like having the right funding. If you don't have the right funding to make it sustainable, then that's another piece entirely. And like digital literacy, like ensuring that the people have the right education and training to be able to engage with your technology, because it's cool to create technology that addresses their need, but if they don't even have the digital literacy to be able to engage in it, then okay, they're not going to use it, right? So that's a hard question to say what not to do, because I feel like there's so many things not to do. But I don't know if some of my answers like started to touch on some of those pieces.
Yes, definitely. And there's something you said, I think you even started to touch on my second question, which is really related to question of access. So that's something that I've noticed a lot as well, which is that when we're promoting digital health technologies, especially in African countries. So on the one hand, there's the assumption that because it's in Africa, it's promoting access, but you notice that can people understand it? Even where is the market? Sometimes the market might be in a high income part of town, but maybe it's the people in the low income communities that probably will have the highest need. So there's so many questions. Do the hospitals have internet? So you might have to end up working with the hospitals that are maybe the higher brow hospitals, because those ones are the ones that maybe already have the computers and the technology and the internet access. And that's where maybe their staff might actually be literate in, digital, have digital literacy. And that is a question I really wanted us to explore a bit more. Like, what does it really take to create access to digital health technology, whether it's for people who can't afford it, people who can't speak the language, people in a different part of town. Like, what does it take? What kind of partnerships are needed? Do you have some maybe concrete examples of models that have stood out in terms of promoting access to this technology?
Yeah, and maybe I can start. I think from some of my experiences, an important thing is truly looking at the population and what they need and where they're at. So for example, if you're looking at a population, say And because I work in Canada, we didn't give some examples here, but I think they're transferable. So like the homeless population, where maybe they don't have, maybe some of them have cell phones, maybe they don't, or maybe they don't have smartphones. So you can talk about like SMS. There are technologies that actually support like SMS text. You know, a lot of people, even in African countries, end up having some sort of phone, not everyone, but like they might not have a smartphone. So you look at like SMSing, like sending messages. There are a lot of examples where like for HIV, people like send reminders to individuals to take their medication, they check up on them, they can text back. So like that is like rudimentary technology. We're not talking about a platform that needs internet access. We're talking about SMS. Again, there is some barrier to that because not every single person has that. You could also look at community centers. So having a place where people could come in and access the internet, and there are people there that can provide them education and support them in either whether it's like a virtual visit or whatever, but there are people there that can help support them. And also looking at providing resources in the languages of the individuals. I think that's an important piece that is often looked over. But being able, like looking at how can you provide the resources in different languages? Can you have people that are on the ground that can support these people in like explaining to them? So people in their community who they trust, because trust can be a huge thing as well. Just given how populations have been treated. Sometimes they don't trust the government, they don't trust the people there. So how can you put in within their community people that they can trust, can be those people that talk to them, help to gain buy-in. So I think some of those pieces, by looking at how you can leverage the community, translate into different languages, and meeting people where they're at. If it's like SMS text that works, that's what works. If it's like going to a community center, that's what works. But looking at them fully and understanding their context, and then providing services that take those pieces into consideration.
Awesome. Yeah. Thank you.
Mm-hmm. Thank you, Morenike, for bringing that. I will trying to start where Morenike ended. I will a bit emphasize on that the aspect of participation that I said in the previously is that sometimes we think we know what other people want, but we don't really know until we talk to them and understand what they really need. So to make, I think, access really improved, I'll talk about two things about, one about inclusivity, but also partnerships. First about inclusivity, it's when trying to design technologies or even trying to initiate any healthcare initiative, we sometimes have that mindset of, for example, if we are helping people with disabilities, we just look at disabilities. For example, people can't move from their home to the hospital. So how can we create something that help them to move from home to hospital, or like how can we get to them? But sometimes we ignore the other aspects, like intersectional aspects of like, if someone can't move from home, did they really have time to go to school and learn? Is that disabled person, let's take for example a disabled person who is at the same time a child or who is a woman. We know women have issues that are specific to them, and people with disabilities have issues that are specific to them. How do the issue like meet? How do they intersect and like create another problem, And that's all. It's really important when thinking about how we can include people in to improve access. So that was kind of a problem that, like I would say, like we should be aware of as innovators, but also as people designing strategies or healthcare initiatives to promote access. Another thing I would talk about is when we are trying to create, or when we are trying to innovate with systems, we should think about partnerships, be it with the governments or even the community. Because I believe I'm an African, and in Africa, we really value the sense of community. You know, we respect the elders, we respect the leaders, and that we can really play that card when we are talking about healthcare initiatives and healthcare innovation. In a way, for example, there is, for example, in Rwanda, we have a network of around 4,000 community health workers. Like each village basically has at least one community health worker, which means like, how can we leverage that that network? For example, if we want to implement a digital solution, instead of distributing a smartphone to each and every person who can be a user, how can we leverage those community health workers? And if we are to support, we can support those community health workers to even support the users, especially in rural areas. That's something that have been really working, especially in the malaria prevention, like distribution of mosquito nets, the contraception, access to contraception. It has really been working here. And also the partnership with the government, because most of the time we have to deal with the regulation, we have to deal with the, getting all the necessary requirement to get your innovation really accepted and validated. And yeah, we see the government, talking from the case of Rwanda, for example, it has really been, it's opening the doors now. Like, you see, they are really opening, because 5 years from now, you shouldn't really talk about an online pharmacy. They were like, no, it's not really possible. But yeah, now they are really opening, flexing trying to loosen the regulations, and to see, and also designing other regulation to bridge the gaps. And I think it's really important to play on those partnerships, but also trying to think inclusivity in terms of a very wide sense of intersectionality.
Awesome, thank you. You both have raised a lot of points that are very important. I feel like we could spend hours talking about them. So I want to see how we can do them justice, because you've both raised a lot of important points. Morenike talked about importance of using the most accessible, simplest technology. It doesn't have to be very fancy. Talked about sort of bringing that on. Sometimes we think you just give it to people, but she talks about having that support. Maybe it's a community center, which in a way is also like an infrastructure in a place that helps people to access technologies. Whether histories of trust, how do you build that trust barrier, language barrier? And you also talking about integrating technology, sort of thinking of the whole person and the whole person's experience. Like, I'm not just somebody going to get a drug. I'm a person that also, does other things, right? You might want to go to school, you might want to go to work. And I think that's so interesting. So maybe I'll start with Morenike. I think something that I found is that it's one thing to build the partnership, whether it's with the government or with community health workers, another thing to sustain it, right? So sometimes you might have a partnership and then there's burnout, right? Especially community health workers, they're needed for so much, but they don't really get paid a lot, right? And then when it comes to government, if I don't know, if something happens, you can lose the contract, or I'm thinking about like Nigeria, right? If the government changes, the whole program can be stopped. So what do you think it takes to really sustain this partnership, especially considering how crucial they are for promoting access?
Yeah. One key one for me is funding, which is challenging, but they do need the required funding to be able to actually work. As you said, they are not paid a lot. And given the African context and how different things take priorities, that is not always something you can guarantee, but that is one crucial thing. You need the appropriate funding to be able to have this place up and running. Without the funding, it just wouldn't work. Yes, you can start it. If they're not getting the funding, they don't have the equipment, you don't pay people, then it's not possible to sustain it, right? That's a very key piece. having the appropriate funding to have these places up and running.
Mm-hmm. Yeah, good point, Morenike. I think it's that's key. But also, what I can also add is, you know, it's I would qualify it of dancing with the systems. You know, like trying to understand how the system is built and know what is already being done that I can leverage, that can save me that energy and even those funds. For example, let me take an example of Rwanda. We are talking about, for example, a program of, you know, sensitizing people about home-based violence, or even like those teen pregnancies. Let's take an example. We know that women and men nowadays in Rwanda, they do have what they call let me try to phrase it in English. It's called parents' evenings. They call it akagoroba kababyeyi, or like it's women evenings. There is also men evenings when they meet and they really share. Like, you know, for example, if you know that exists, you can request, for example, some minutes that would save you from organizing a separate event and like leverage those existing events, existing systems that exist, and power, you know, those power dynamics, if I can say, called, like, for example, if you know, if you are able to talk to the chief of the village, it's likely that your message will easily get to the people than if you do it yourself, like even investing money or hiring the people who are going to the people who are going to spread the message, you know. So I think if you are really able to know how the system works and trying to leverage the existing network before you create even everything new, first of all, it will show that you know, the people, the local people, you know, those members of the community will not get hard time, you know, figuring out what's going on, what's new. It's like, it would be like in the same process as they are used to, but also it will save you some money in terms of human resources, and also save time of the people.
Systems. Got it. Okay, thank you both. So we talked about funding, and we talked about, I like what you say about dancing with the system and understanding what resources, networks exist that you can leverage on.
Exactly.
Which is a big part of what it means to innovate. You know, it's not always just bringing up something, it's really that whole process. I wonder if you both can walk me through. I feel like, you know, when you give, like Morenike gave the example of the homeless population, I felt like I could see it happening, you know. So like, can you give me an example from your work, like just quickly about like, okay, we wanted to address this issue. This is how we went about coming up with the idea. This is how we refined it. This is how we tested it. This is how we danced with the systems. This is how we ensured that the partnerships were sustainable. Does any example come to mind, maybe in your work, or examples you've seen, or people, partners, or things ongoing that have caught your interest? I think it will be very enlightening for our listeners.
I can give examples. Again, a lot of my examples are based here, so it might not talk to some of the intricacies that are involved in Africa and just like some of the barriers we have there. But just thinking about, I think for us, in some of the projects that I've done, we always have to start with like the people and the why. So even if we're working with like a clinical program, or someone came to us and said, oh, we want this technology. For example, I was working with a diabetes in pregnancy clinic, and the problem was that they had currently, or at the time, what they were doing was that they were recording their blood glucose readings in the paper. And the clinicians were not able to know what the readings were until the people come in. Sometimes when they come in, it's like, oh, they didn't need to come in because your readings are great. And then these pregnant women have already taken time off work, taking transportation, coming to the clinic, and then they're spending 5 minutes with the clinician. And it's like, okay, how do we make this a more efficient process? And so what they decided was that they wanted to be able to get the readings prior to. And sometimes there were issues where sometimes women will actually lie about their readings because they wanted to seem like they were doing better than they were. So calling was a thing they could do, but then they were not sure exactly that those were the readings and some of those issues. And what they decided was like, okay, how can we remotely track these readings? And what does that look like? And so, but before we even went into the technology, we really had to talk to the clinicians and also the patients to understand truly what the problem was, so that the technology that we're going to implement would truly look at the different facets for the women. So the women, it was that they didn't want to come to the clinic if they didn't need to. For the clinicians, they couldn't plan the clinic appropriately. They couldn't have the right resources because they never knew what the day was going to look like. It was dependent on what they saw on paper. And so what we ended up doing was implementing a remote monitoring platform where the patients could track their blood glucose readings remotely via Bluetooth. And once they do that, it would go into a platform that the clinicians could see. So the clinicians could see if something was really, really high, really, really low, and could provide interventions as needed remotely. And then the patients didn't have to come in as often. It was more coming in based on when there was a need. And then they could also talk to the clinicians remotely. So it could be like, oh, I'm having this pain today. Is this normal? And then someone would like respond to them. And the way they did the system was that it would only track when something was higher than a certain level or lower than a certain level. So the nurses didn't have to continuously just look at every reading. It was when something was flagged that they knew, okay, there was an issue and I need to provide an intervention. And then, so that was helpful to both parties, right? They could plan things more appropriately and also provide care as needed. You're not waiting 5 days for somebody to come in and bring you a piece of paper to provide an intervention. And I think that context, like it is transferable in Africa, but obviously you have to think about different pieces. Do people actually have access to like the Bluetooth monitor? Are you going to provide it to them and all of those things? We also did something with HIV patients here, where a lot of them were people who were like minority groups and had a lot of other just economic factors. And so what we did was more the cell phone and SMS, and where we would send reminders to say like, okay, take your medication. How are you doing today? They could respond and someone would respond back to them. And so because a lot of them didn't have smartphones, the people we were working with at that point in time. So it was like SMS is the easiest we could use. And then so interacting with them in that way. And one important thing and challenging thing is that it's easy and nice to say all of these things, but it's actually not easy on the clinician side from a workflow perspective because they still have other patients, right? They still have other things they have to do. So an important part when you're talking about technology is really ensuring that it can easily be integrated into the workflow of the clinician, where it's not adding like 30 minutes more per patient to their work, because then they won't do it. It won't be sustainable because even though they know it's adding value, it's just too much because they have so much going on. So an important piece is always ensuring how do you make sure that it's truly integrated into the workflow. So something we usually do is like, we'll map what their current workflow looks like. We'll talk to them and say, okay, what would be the best way to integrate this? Should it be more like during intake, then you can talk to the patient, or is it more like truly just walk through the workflow and try to make it as easy and simple as possible for them? If not, they won't do it like long term.
Yeah, that's so interesting because you can think
that's really a great picture of how it is done. And I think just adding to what Morenike just said is, it's one of the most difficult things to do for innovators is like keeping things simple. You're really excited and you want to do everything on earth and heaven, and like it's you want to do it all, and you just sometimes you want to impress people, trying to see, if talking from my experience, as a digital platform, what we had in our mind was really a big platform, like, looking at those banks, for example, those those banks have applications that they use for transaction, and you find that, they are really sophisticated a lot of things. But we came to find, as we were working on that, it was money consuming, but also not really bringing as much sales as we expected. So we've been thinking, and we found that most of the time people find it not easy or to start a new thing, like start using a new thing. For example, starting even from downloading a new app from your phone. That's something that risks of cutting off some of your customer base. People who just don't want to download anything new in their phone. And we found we thought about using WhatsApp, that functionality of WhatsApp business. And people are now just on our platform, we said we put a link to our inbox. You can order using WhatsApp. Was just something to test and see what people think about that. And it find even those who used to use the platform shifted to using WhatsApp because it's easy. You can chat, you can send pictures. If you have a medicine you want, you can take a picture of its cover. You can take a picture of a prescription, and that's something that's really easy and that everyone who has a smartphone can do. What we needed to do in that case was now that we can just keep it simple, how can we make sure that it's secure? And that gave me a lesson of how can you just leverage the existing things and just try to customize it and improve it. Now WhatsApp is providing an API for business so that they can even integrate those payments, and you can see the future is really bright for if I can say, for the virtual health innovator and digital health innovators, trying to use those simple things that are really common and without really that need of just bringing new and impressive, building a new word, if I can say.
You will have it's interesting because both of you are also saying the need to make it simple for the clinician, make the flow simple, whether it's for the workflow for the clinician, whether it's for the people who are using it, and all the things you have to think about, from different sides, from the patient side, from the clinician side, from the system side, sort of the community side, the technology side. So it's really interesting. I heard someone say that, innovation is not necessarily just invention, it is solving a problem. So it's not just making something cool, but actually making sure that it contributes to solving a problem. So as we think about solving problems, I was wondering, so who creates the demand, right? And who funds it? So for example, do you just sit down and be like, this community needs this? Or is it a request come from a community? Maybe somebody is watching this and is thinking, oh, I want to fix this or something, right? How does this start, right? Maybe we'll start with Morenike, is it the government? Is it you? If someone is sitting down watching this video and be like, you know what, there's something in my community I want to fix. What would you tell them to do?
I think the short answer is that it could start from anywhere. It could start from the government seeing the need. It could start from you identifying a need in your community. I would say especially in the Nigerian context, when I talk to a lot of people in the digital health space, the incentive is it's more like making profit. They see a problem that needs to be solved. Everybody wants a piece of the pie. There are not a lot of regulations in Nigeria, actually about a lot of African countries, I think, compared to here. So the barrier to entry is not as much as in more of the Western world. So if they see a problem and they try to solve it. I think from the Canadian context, a lot of it, for the vendors, it's similar in that they see a problem and they try to solve it, but there's also the government component of, okay, we have rising healthcare costs, we have aging population, we have all of this, like what are initiatives that we can fund to ensure that we can start to reduce some of the burden in the healthcare system. But I think in the African context, we cannot wait for the government. I think a lot of it has to start from people seeing a problem and looking to solve that problem. And in the African context, I would say that it's more even important to truly understand what the need is, like what Arnaud talked about, like looking at all the different intersectionalities and taking the whole person into consideration. You can't just go off on a tangent because this is like a cool technology. It's going to backfire. It has to truly be solving a tangible need, and that has to be your anchor. Like you have to come back to that. Okay, we're doing all of this. Is it still solving the need? Yes, this could be fancy, but is it still solving the need? Is it simple? Is it accessible? And not get carried away. You have to have that anchor that you come back to be able to create something that's impactful. So I think it can come from any angle. It can come from patients. It can come from like someone in the community who sees the issue. It could come from the government. I think it could come from anywhere.
Thank you,
Morenike. I will compliment Morenike on like, it can start anywhere, but I think the closest way is yourself or someone closer to you. Sometimes most of innovation, I don't know, I haven't made some research, but it may start from your frustration, you know. You've been waiting a lot of time at the clinic. You've not been able to find what you needed, and you just ask yourself, you know, is it only me, or it may be any person else around me? And that's how you trigger it in your mind, and just try to ask, like, you know, what happened to trying to see after you experience it. That's one way to start. And after you experience that frustration, that's how it started with me. And I asked what the person who became my co-founder, like how they try to solve that problem of getting medicine that they wanted. I was looking for a medicine for my mom, and I spent a whole afternoon looking it in the wrong place, while like the place where it was really near home. That was how it started. And I asked another person, you know, we found that it wasn't really myself only, and like I found that everyone around experienced it. And you find that, you know, you can do it, but the basics of the basic of it is just, is it a problem? Is it real a problem? If it's a problem, now you start thinking about the solution.
Got it. Thank you. And I think we're going to come back to that. So maybe a related question is that I'm thinking also, because to make sure in the time that we have, we touch on this question of perverse incentives. Morenike said something that, you know, there's sort of that, if you see an opportunity, you go it, especially like in the Nigerian context, for example, right? It's very important. At the same time, I think health is such an interesting thing, because sometimes the problem that's profitable needs to be solved. You know what I mean? Like, let's say people having a lot of accidents, right? And you go and solve the problem of maybe healthcare when they have accident. But the question is, you know, at some point, when are we going to fix the road, right?
Yeah.
So my question is, like, there's a lot that is profitable, but we can solve it downstream. But at the end of the day, we just we can't really afford to solve it downstream, because a lot of people can't even pay for it. Like when you think about chronic disease, when you think about someone that's living hypertension that has to take a drug all their life, or cancer or things like that, and in their neighborhood there is like constant pollution, and you know that more people are going to have this challenge, right? And this is something that's happening a lot in the African setting, because yes, everybody knows, oh, okay, there is a burden of infectious diseases, but there's a lot of urbanization, food landscapes are changing, and now people are also having high burden of chronic disease. And a lot in poor areas, you have that combination where somebody has, maybe they'll have an infection that puts them at risk for chronic disease, or they have poor diets in childhood that puts them at risk for diabetes later. And I'm just wondering, I would love to get your thoughts on what role can innovation play in addressing sort of this connection between what we're seeing downstream and what is driving it upstream? We've sort of touched on this when Morenike had mentioned, like, for example, bringing in community centers, which to me is like, it's not, okay, now people can access technology, but looking at the broader issue of providing them support in the community, not just individually. And I think, Arnaud, you had also mentioned is when you talked about intersecting with people's lives, right? So what they experience and around them. But I wonder if we can talk about it a bit more from this connection between downstream and upstream and what your initial thoughts are.
Mm-hmm. Yeah, maybe I can go first. What I think, like trying to refer to the Bible, Jesus, when the person wanted to help, I don't remember what the verse, but they say like, poor people will always be there, and so will be the problems. Problems will always be there, but you can find a role to play. What I can say, you can't really solve all the problems of the world, but you can do something. That's what I would tell someone to do that. So what you can do is, first of all, when you're trying to understand a problem, the same way you do not want to just create an output or something that would be a product of the innovation, but you want to create an impact. The same way we go on to the other side, trying not to understand what you see as a problem. For example, if there is an accident, don't just see it as an accident. Someone is injured, but what causes that accident? And trying to understand until you get to a point that you say like, I can act until this level. To this level, I can act. But if you can't, maybe you can play that role of advocacy, and other people may solve, or even other generation may solve it. That's how I understand, like, if you are trying to solve a problem, don't just take into consideration those superficial things that you see, or those superficial events that you see, but trying to think about, what is really wrong with that? What is the main cause of that? What is the origin of that? And you may find even like, is there anyone trying to act on that I can really complement? That's how I understand in terms of defining the problem, but also choosing where you start and where you end your action, because you can't do it all.
Yeah. And that's a good point, because in reality, it is such a complex thing, and it's not like 1 + 1 = 2, because there are a lot of systemic issues when you talk about health. Like, it's not just, there's so many things that are involved, right? Like the person's economic status, like social determinants of health, right? Like all of those pieces, but even just like you said, like the roads, the fact that we don't have good roads is what's causing the accident. And so I think we have to target the problems from different ends, and it doesn't necessarily have to be the same person solving all of the issues. There are systemic issues, there are policy issues in, I would say, Nigeria, because that's what I'm more familiar with, that need to be solved. And the thing is that all of the different players have to come together in some way, but we cannot expect like the common man on the road who is looking to say, okay, I want to help this like the diabetes population. He's not going to be the one to then come and solve the road, right? Like, even though he could be aware of it, but we have to solve the issues that are here, while we also look at the preventative pieces. And honestly, I think that is more for the government. And this is another conversation as to would they actually do it, and what does that look like? But I think there's so many systemic issues that come to play, and healthcare is not in isolation, or even digital health, because when you talk about digital health, you also have to think about the healthcare landscape and the issues that are there, because it's not in isolation, they are all interrelated. And I think it is important to think about the systemic issues and think about them and how that influences the solutions you provide, or influences how you meet the people where they're at. But we cannot expect this. I don't think we can expect the same individuals that solve the like chronic disease pieces to then be the ones that take all the preventative measures. I think someone else has to solve that problem. But as a government, we have to have such the systemic view and put in place all of these levers that can help to solve the issues. But that's a whole different conversation where we talk about how do you even do that. But it's not an easy issue. There's so many factors that come to play, and it is important for you to have that at the back of your mind while you try to solve a problem. But you have to take it step by step, one issue at a time, because you can't solve everything.
Good point, Morenike. I think I need also to add that when trying to address that the systemic issues, you as a person, you really need to know where you are located in the system, to know like what you need to do.
Yeah.
Okay. No, thank you. It's like we can't solve everything. I mean, it's definitely true. And I think there's something you have said around understanding your place in the system, understanding who your partners, what you can complement. It also makes me think about how sometimes, even if you can't solve everything, there are certain business models that allow you to bridge a gap. Like maybe if you use a leasing model that brings down the cost of a certain service, or by using technology, maybe people in a different place, maybe in a rural area, might be able to access it. And so I think what we're saying is sort of understanding where you are, understanding to what extent your innovation can bridge some of those systems problem, and then understanding, I guess, where you stop or not where you stop, but what part of the big challenge is yours to sort of focus on, right? Okay. Thank you very much. We have a few minutes, and I want to get to this question of the African space. So there are two questions I want to get to. So in terms of the landscape of health technology, health innovation, connecting into systems, I would love to hear from you, Arnaud, on where you think the African space is going and how you think that it should evolve. Right. So, for example, are there areas that you think that we definitely need technology? Like there can be a big win if we bring in technologies to address some of these issues. And then also, what evolution? I know Morenike had mentioned like the need for like what they call it. For example, questions around who said this, like privacy and things like that. So like how do you think the space should evolve to be mature and to be impactful?
Well, having been part of the Africa, the Health Tech Hub Africa, that is based here in Kigali, I like the way young people are shaking tables, in terms of healthcare. We have been like 30 startups from across Africa, and you will find that you should expect that people from Nigeria would have the same innovation as people of Rwanda or people from South Africa, but that's not the case. Everyone really have an original idea, all those 30. And you will find that this is really impressive. And they have, we are really contributing to one goal of, improving health access, making healthcare easier to get, especially from people from rural areas and so forth. And you will find that the way like people are really trying to solve the same problem, but using different solution is really, really impressive. So this one thing is really promising, like looking at how young people are really engaged in like innovating for healthcare. I would say like healthcare compared to other industries, I would say here fintech or education or even agriculture, things like that. Healthcare may be kind of lagging behind, but it's really coming. It's really coming in a way that even now, for example, governments are really understanding the need to adjust policy, like we're talking about the privacy policy, like how can we really make like loosen the regulation to bring that flexibility to people who want to innovate in healthcare, like access to data. How can we really make people in the health tech industry to easily access data, for example? I'm giving an example of one startup that who are working on the usage of artificial intelligence to ease or to facilitate diagnosis, like especially the X-rays diagnosis. And we find that can those people really access to a database of all the X-rays in the hospitals? What does it take? What policy does it take? And government now are really trying to understand it, and you can see it even in the creation of continental bodies such as the Smart Africa or what do they call it? The Fourth Revolution Center, that is covering that gap in terms of access to data, privacy regulations, and also making it a continental thing, not just making it each country operating in silo. Because like even if we may be different in terms of in terms of problems, but we still one continent, and this is really important in addressing issues that are relevant to the continent. We really need to act together to not spread to not scatter our opportunities, or even scatter the focus. We need to really focus. For example, if I'm repeating what someone in Nigeria can do, why can't I partner with them and like open a franchise here? If someone in Kenya is working on a solution that can really be customized to Rwanda, why can't we make it a matter of a regional matter instead of just creating a new thing in Rwanda? This will also try to save funds, trying to save energy, and everything will be we evolve like together in that togetherness and oneness as a continent.
Got it. I'll come to Morenike soon, but I want to ask one extra question. So when you say, so you're saying need for sort of regional collaboration, regional frameworks, is this something that you're seeing that is driven by, will I say the entrepreneurs? Is it driven by the government? Is it driven by the investors? Who do you think is sort of facilitating this kind of regional frameworks and collaboration and sort of momentum?
Yeah, well, I think everyone has their part to play, but I think government have really I would say the foundation of it, because if a government doesn't accept to open doors or open borders to another country, talking about that, I think we are talking about healthcare, but you will find that the African common market will play a part to facilitate, the moving of, funds, the moving of knowledge. If those centers, I would say, like the Health Tech Hub Africa is created, it's something that can really that bring together people from all across Africa. So I'd say government really plays a role in terms of facilitating things in terms of policy, but also thinking beyond health, but also the way policies are made and the regulations. But as entrepreneurs, we also have a big role of advocating for what we see can change, because I'll say I think we are the third online pharmacy in Rwanda, and the oldest is now 2 years old. So when they really struggled to go to the Rwanda Food and Drug Administration Authority for a license, because like that was really something new. But if you don't really try it, sometimes the government has many other priorities that they don't really think about things that they're not that proactive. So it's up to us as innovators to be proactive, say to give like proposals, I propose that, so what can I do? And as the government, you should facilitate me or guide me, like, you can do this, this is not possible here, so can't we just adjust it like that? And this collaboration between innovators, but also the support from and facilitation from the government can really play a bigger part. And after that, when that collaboration is there, I'm really confident that investment and funds, they follow. Wherever there is opportunity, funds follow.
Awesome. Thank you, Arnaud. Morenike, relatedly, I think I want to ask you, do you think that maybe more from the technology side, what technologies do you think are going to be shaping the future of health? So sort of, what do you see on the horizon in terms of where the space is evolving?
Yeah, I think one big one that is starting to mature is around artificial intelligence and machine learning, and how that can be used to solve problems. It creates efficiencies. We're seeing that in radiology. We're seeing it in so many different areas. And I think that is something that we're starting to gain momentum, but I think there's still many ways in which it can be used. But I actually wanted to touch a bit on like some of the things that Arnaud said, and just even in the African context, because from my interactions with people in the digital health space, like in Nigeria, a lot of people are focusing on solutions that where they're reaching people who have the resources, who have the money to be able to afford it. So there is an increase in the equity divide, because people are not really looking at the poor people in the rural areas, because they're not able to really make a lot of money from solving those kind of problems. And usually it's more the Bill Gates Foundation, WHO project, or all those type of donor funds that are used to focus on those type of problems. So I think the government does have to play more of a role. They need to realize that digital health truly could help the advance health outcomes and start to provide more investment in that space, because, and I understand why people will want to solve some of those hefty problems where they can't get too much of a profit, just given all of the other economic barriers in Nigeria. So I think there is a role for government to play more of a part in that. And as Arnaud said, like more advocacy for them to be involved. And one thing I'm starting to see is everyone is creating their own thing, right? Like as Arnaud said, everyone has a spin to their problem. But one of the key pieces in digital health to be able to really make use of it is that we need access to data. We need the information. We need to be able to have it in a coordinated manner, in a standard manner, to be able to inform health system planning. But that's not happening because everybody has their solution. Nothing speaks to each other. Everyone's created their own silos. So we need the government to start to put in place things like standards, like what people need to adhere to, so that this information, all of this data can actually be used on a system level to help in like planning and more preventative pieces, as opposed to all of this like episodic care, because that's where healthcare is going to, right? Like it's more the preventative, but we need data to be able to do that. How do you create the right infrastructure, the right incentives for people to be able to create solutions that can speak to each other? Because even like in my role now in Canada, it's a huge problem. Systems don't talk to each other. And Africa is heading there because everyone's creating their own thing. And learning from the problems or the issues that other countries have had, we can start to think about it. How do we create a system where we can have this data in a consolidated manner and actually leverage it to make decisions? So I think there's a role that government has to play in terms of like regulations, putting in place standards, and creating incentives for vendors and entrepreneurs to want to work together, for them to have platforms and solutions that can speak to each other. Because if not, it's just, what's the point? Because data, as we know, as everyone says, that's the new oil. And we need that data to be able to make informed decisions. So that's one piece, but I just wanted to touch on that. But yeah, I think AI is one piece. There are things around like augmented reality, virtual reality, but I think AI truly, really can make an impact. And it's not going to be AI alone. Obviously, you're still going to need like people to be able to validate it, but then you need as much people and just the insights you can get, right? In terms of like, what are the factors that get someone here? There's so many pieces that as a human, it's hard for you to even like start to comprehend. But as we continue to like train all of these machines, they're able to provide good data that can help us make good decisions, both on the personal level, but also on the system level, which I think is quite important as well. Sorry, I feel like I touched on so many different pieces.
There's a lot to touch. In the interest of time, I want to see if I can sort of integrate the key things for our listeners today. So something that has really, actually, let me start from the innovator side. So keeping it simple, dancing with systems, we talked about that. We talked about sort of digging deeper to see, like, really understanding the problem, sort of touching the box of the system. I feel like laughing about when you were like, innovators can't do everything. So I think it's also sort of understanding it and understanding what your slice is. And I think Morenike had mentioned anchoring on need, am I actually solving this problem? Not necessarily something fancy. But something else that came up from our conversation that I'm surprised at how strongly it came out was also sort of that interplay between innovators and the government, right? I think I'd even expect to hear more maybe from funders, but it's really government that's coming up, because government is probably the one that has to have the policies around sort of certain things, like how this data can be used across different systems if we want to address systems problems, how they can talk to one another, how we might potentially, yes, entrepreneurs can sort of pair certain technologies with enabling infrastructure, but when it comes to the population level, government will probably have to put some enabling infrastructure that can then allow you to make that technology accessible. So that was something very interesting that came up in our conversation, creating the incentive, sort of shaping the market so it goes in a certain direction where innovators can then solve problems a bit easier. But then at the same time, innovators sort of leveraging that their capacity, their knowledge and expertise nationally and even on a continental level to push for policies that take the world digital health in a particular direction. So it's been a very rich conversation. I feel like each thing we talked about could be like a panel on its own, but I think we're going to have to bring it to a close now. So before we go, I wondered if there's any final things that you have to say. I'll start with Morenike. Any final things that that maybe we haven't touched or you just think is very important for us to end with?
I'll just say like equity, like for the innovators and the entrepreneurs, just have that in mind as you create solutions. It's so important that we do not continue to widen the health equity gap with solutions. Like really think about different people, not just the wealthy people, not just the people who have the economic resources. Think about the others as well, and think about how you can be inclusive in the type of technology and how you deliver your solutions. I think that is so important, and because healthcare is for everyone. That's the last thing I will add.
Thank you. And Arnaud?
I would address myself to innovators, fellow innovators, to always put the patient, the user, the customer, whatever you call them, just put them at the center of what you're doing. Listen to them and, do everything to ensure that you are doing really what they need. Yeah, that's my last word.
Thank you. Yes, and you had said making sure that the user is the owner of the technology, the user is
exactly.
Awesome. Thank you very much. I'm sure that people who are listening we have gotten a lot of rich perspective, regardless of where they're coming from, whether they're a policymaker, whether we have some policy advocates that are part of the festival, whether they're people who are thinking of solutions, or even people who are sort of playing more of more of the service provider or advocacy space. I think there's something for everyone who's listening. So thank you all for such a rich conversation and for being a part of the festival this year.
Thank you so much.
You're welcome. Thank you.
This was an exciting conversation.
Awesome. Well, thank you all.
Thanks.
Bye-bye.
I've enjoyed it.